Welcome to Fuzzybutts and Friends. Whoop, as much as it drives Fuzzybutts all over this place, absolutely crazy when they hear me say it. I am the host of this show, your big dog, Luke Robinson, back again with you this week. And look over there next to me, back again this week is Ginger Morgan. She's our co-host and co-producer, and she's also the executive director of the Puppy Up Foundation. Ginger, how are you?
I am doing well. I'm really interested in learning more about our guest today and which all the things she's done since we talked to her last.
You must be excited for it because you didn't. I gave you the opportunity to talk about the weather.
Weather, I know.
You didn't. Well, there's not much to talk about because it's gorgeous outside and it's lovely. It's warming up. It's almost springtime here in the Memphis area. But you're right. It is exciting. We've had our guest today on Fuzzy Butts and Friends on before several times before to talk about her exciting technology, Ginger, and we're excited to have her back again today for this episode. So on that note, let me introduce Dr. Andi Flory. She's with PetDX, and you're the Chief Scientific Officer. Is that the correct title for you, Dr. Flory?
Very close. Chief Medical Officer.
Chief CMO, some do CSO, some do CMO. Chief Medical Officer. Well, you're the person that makes all the crucial and important decisions, and that's why we're glad to have you back on the show, Dr. Flory. So, for those of you who haven't heard Dr. Flory and the story of PetDX before, we were going to start with a little bit of an introduction and an overview, and then we'll get into the updates and some of the new and exciting things you've got going on there at PetDX, Dr. Flory. So go ahead, tell us a little bit about PetDX and your involvement with them and the technology, and then we'll get into where you're at today.
That's great. Thank you so much, Luke. It's so great to be back with you both. I just love being a guest here because you guys care so much about cancer in dogs. So thank you for having me again. So I'm a veterinarian by training, and I am actually a board certified specialist in medical oncology. And so my involvement with PetDX is that I was part of the founding team back in 2019. Overall, we are a company that makes DNA-based cancer detection blood tests for pets, starting with dogs. And our story really started with one little dog, and her name was Poppy. She was just adorable. She was my patient back in 2019, all 8 pounds of her. She was unfortunately diagnosed with cancer, but her cancer was already very widespread by the time it was found. And for her family, for my veterinary team, that's devastating for everyone, especially because she was very young. She was only about 4.5 years old. So Poppy's dad, as it turned out, her owner, he is an MD by training, and his background expertise is in something called genomics, which is the study of your DNA, basically. And he had helped to develop DNA-based blood tests for people for cancer detection and for other disease detection. And he realized, hey, you know what? If there was a blood test that could have helped me and my family know that cancer was present earlier, we probably could have, treated her better or sooner or known about it sooner, that this would have been a treatable disease rather than what he experienced, which was, it was found so late, there wasn't a whole lot that we could do. So he brought this idea up, and it went from idea to company very, very quickly. Such is the life of a startup. But we are, something that is really important to us is that we're a very science forward company. We, started our first clinical studies just a few months after this was an idea. And we ended up, we've enrolled thousands of dogs into our studies at this point. And we've performed really, really large clinical validations, meaning published studies to kind of prove how well the science works and how well the tests work and things like that. Like 1,100 dogs in one study, over 1,900 dogs in another. And so we're a very science forward company, and we believe in kind of the use of strong data to kind of show how well this technology can work.
Yeah, it's just amazing how just this love of a fuzzy butt can have such a tremendous impact in the universe. And that's one of the reasons why we love PetDX's story. And we love having you back on all the time to update us with what's going on, because Poppy, it just all came down to Poppy, changed the game. And as we've spoken to before, Dr. Flory, we know that one of the big problems how nature designed dogs and companion animals as well is that they don't show pain, and they just have to live and keep living until they don't. And so that makes it very difficult to clinically diagnose cancer early or detect cancer early in our companion animals. And so often the case, and as is often the case, and it has been with Ginger and many of her dogs and mine as well, the cancer was just caught too late. It was caught late. There weren't any early interventions, and you're behind the game. It's just you're fighting an uphill battle. And so we know the pain, the literal pain, and we know the need for PetDX and your technology. And it's just such a great story. And it's more importantly, it's great that you're doing well, that you're out there. Your product is commercially available to dogs. It's only dogs, right, so far?
It's only dogs, yeah, for right now. It's a common question that I get asked, and I think there's a good reason for that. You know, cats are really also very good at hiding symptoms until things are pretty advanced, and so that idea that we could use a blood test to find disease early in any species is really enticing, but cats as well. You know, they get a lot of diseases that can be really hard to diagnose, even with the most common tools that we have. So early detection is really appealing, I think, in any animal.
Do you think this is probably an early question, but it's a nerdy question, and I love questions like this? Is that do you think that OncoK9 will be a platform for other species, in addition to cats, but also other species as well that we know that also get cancer?
I mean, there's, theoretically a test like this can be done in any species where the genome has been fully sequenced, right? So it uses a species-specific genome, or kind of that set of instructions in the DNA to compare to. So theoretically, this could be done on any animal where that genome is present. But not at this time. We're not kind of looking into the other species that are out there. But yes, theoretically in the future, I mean, the sky's the limit, right?
Right. Well, the dogs, for whatever reason, dogs get cancer, as we know, a lot more than any other species. I think I was at your website, and the number that you're using, your new site that I think we're all using now, is 6 million new cases every year. You're using actually 1 out of every 3 dogs, which is, we've always used 1 out of 4, 1 out of 5, but I mean, there are some breeds, as we know, it's 1 out of 2, 1 out of every 3 is going to get cancer. So we know it's a big problem. I love your new website, by the way, for OncoK9. It's wonderful. I don't think you had that up last time. I don't think that was launched last time. Everything was under the PetDX website still. Is that new?
Yeah, so we have a new website, which is OncoK9.com, but we also still have our main website, which is PetDX.com, and there's lots of information on both. The unique thing about OncoK9.com is that this is the site that's really describing our portfolio, meaning it includes our newest test, which is called OncoK9 Screen.
Yes, and we'll get to that in a minute. I'm excited about that. That I know we have not discussed that as of yet. I think we talked about the potential. I think we're last time we spoke, it was coming on the market pretty soon. I wanted to bring up your website because not only is it very informative, it's also very attractive. It's such a nicely done website. I have so many of these. Unfortunately, I guess it is this right here. Nope, I guess I can't. I guess I can't find it because I think sometimes I made the mistake. I have way too much on my desktop, and I made the mistake of actually embedding your web page on the Zoom page. So for some reason I can't do that. But I highly recommend everybody go check out the website. It's very informative. It's it's easy to use. It's very clear, very straightforward, and very pet parent friendly, I guess. So to definitely check out the website. Congratulations on that. Well, let's talk a little bit about, before we get into the OncoK9 Screen, let's talk a little bit in detail about OncoK9 DX and how that works for pet parents when pet parents need to take their Fuzzybutts in to get their first blood drawn. Let's talk about the DX first.
Yeah, so OncoK9 DX is kind of our flagship test. This was our first test, our classic test. This is a sequencing-based test. So this looks at, a technology called next generation sequencing. So it's looking at the DNA in a blood sample, and it's specifically looking for the presence of tumor DNA in that blood sample. And the way it does that is by looking for the presence of abnormalities in the DNA, because really the only thing that's going to cause changes in the DNA, we call those genomic alterations, but you can kind of think of those like spelling mistakes in the DNA. The only thing that's really going to be associated with that is cancer. Things like infection and inflammation and things like this are not going to cause a change in the DNA. And so it's very specific for cancer. And it also means that it's a multi-cancer test. It's not just for like one or two types of cancer. It actually can detect over 30 different types of cancer, and with a high sensitivity for the most common and most aggressive cancers that we see in dogs. And I know we've talked about this when I've been on the show before, that, these very aggressive cancers that we see in dogs, lymphoma, hemangiosarcoma, osteosarcoma, these are really aggressive and they're unfortunately very common. And the detection rate in these cancers is very high. It's 85%, but with a very, very low false positive rate. So this is a test that actually what that means is that you can use it in a variety of ways. It can be used in asymptomatic dogs at a wellness visit as a screening test. So just like you or I, we go for cancer screening tests like mammograms and colonoscopies and PSA tests. So as a screening test when added to kind of the routine wellness visit. But it also can be used in sick dogs where cancer is either suspected or it's on what veterinarians refer to as the differential list, meaning there's a wide variety of things that could be causing these signs and symptoms that we're seeing, and cancer is one of them. And so this is a test that can help to kind of figure out if that's which way things need to go in terms of the workup. But it also can be used for monitoring cancer. And this is a paper that we just published in December of last year in the American Journal of Veterinary Research, looking at using it for patients with cancer to monitor them over time. And that can help a veterinarian know if the patient is likely to be experiencing recurrence of their cancer or is at high risk of recurrence. So it can really help to kind of shape what that follow-up plan is. And I have this one case example for this test that I just love, and I think that it really demonstrates the power and how this test can be so useful. And it was a case of a golden retriever, an older golden retriever, and I'm sure you guys are well aware of the Morris Animal Foundation Golden Retriever Lifetime Study, which is a lifetime study that's looking at one breed of dog and saying, like, what are the things, what are the risk factors and what do we diagnose and how do we diagnose it, and, that sort of thing. And what's amazing in that study is that of the dogs that have died so far, 75% of them have died due to cancer, and the vast majority of those are due to hemangiosarcoma, which is a cancer that we just don't find early by our normal mechanisms, right? We find it once they're bleeding, they have a bleeding tumor. So in this case example that I love is a case that a dog that had OncoK9 DX performed, and it was a situation that a lot of, I think, families or vets experience, where this older golden retriever was completely normal at home. And then all of a sudden she had this event where she just didn't seem like herself. She kind of collapsed, or she just kind of sat down abruptly. She stared off into space for a minute, seemed out of it, but then she popped back up and was normal. And of course, as a precaution, her family brought her into the vet, but by the time they get there, she's wagging her tail, she's running around, her exam is normal, her blood work is normal. And one thing that the vet could have said is, she looks fine to me, just keep an eye on her. But because they knew about this test and they knew that golden retrievers are at such high risk for cancer, her veterinarian said, you know what, we have this test. Why don't we run this so that we know, we have another tool to be able to look and see if this is something really worrisome. And so they ran it. The test results took about a week to come back. She was normal in that intervening week, but it did come back positive. And the result of the test is it's a cancer signal detected or cancer signal not detected. So when we get that cancer signal detected result, what we know now is this is urgent, right? We don't want to just wait and see. We know that if we're going to do something about this, we should go and look for this right now. So it tells us the urgency, and it tells us, yes, you should go and look for this. And so she had a workup, ultimately found that she had a mass in her spleen, but it looked stable. And so the family was able to kind of have time to think about their options, time to schedule the surgery with the veterinary hospital. The veterinary team was able to put that into their schedule at a time that made sense for them. And it wasn't an emergency. They did a scheduled procedure. When they got in there, the tumor had not bled, it had not spread. And although her diagnosis was hemangiosarcoma in the end, it was stage 1, meaning it was small, it hadn't spread, it wasn't bleeding. And we know the dogs that have hemangiosarcoma, if you can catch it when it is stage 1, then the prognosis is actually, the survival is twice as long as when we find it when it's more advanced. So this is, I think, just a really great demonstration of how this test can help just make it a little bit clearer of how worried do we need to be right now? Do we need to jump into the workup, and how urgent does that need to be? And for Kelly and her family and her veterinarian, there were so many benefits for all of them.
Yes, you never want to let hemangiosarcoma get to the critical stage where you have to do the splenectomy and you have internal bleeding. It's a mess. Been through that a couple of times, and that's a powerful story, and it speaks to the potential of your platform technology. So in the case of, what was the dog's name? The golden retriever?
Kelly.
What was it?
Kelly.
Kelly, of course, Kelly. So in the case with Kelly now, so they removed the mass, and so now are you going to be doing screening every year or more frequently to make sure that there's no reoccurrence or there's not another tumor mass?
So yeah, so this is the power of this test, is that it can be used in multiple ways. And when you have a patient that has a tumor that has a signal that's detectable by this test, then now you can use this over time, longitudinally or serially, to monitor these patients. So, and that's the paper that we just published. But the way that this can be used is it can be used, take a sample after surgery to make sure that that signal has gone away. If it doesn't, it could mean that there are metastases, or there's some more disease hiding somewhere that we would want to know about, because we would manage that case differently. Or it could mean, from our study, it showed that patients that where the signal goes away after surgery, they're less likely to have recurrence in the follow-up period. So it can help us to guide and tailor their therapy and kind of know what we're looking for. It also can be used at multiple time points as another tool for us to look for evidence of cancer coming back after we've treated them. So we can perform these tests, during their treatment, and have a good way to know, okay, when do we need to be worried that this cancer is coming back?
That's it really is powerful. And it's also wonderful that you have data results from analyzing that. Which journal was that paper in?
That's in the American Journal of Veterinary Research, AJVR,
Okay.
and that is an AVMA journal. So those are the sister publication of that journal is called JAVMA. That's the most widely read publication that most veterinarians read, and this is kind of the research arm of the AVMA journals.
Yeah, I'm going to read that one. I think the link is on your website, the OncoK9.com website. I think I saw it there. Okay. Yeah, I want to go read that, because that's just, I mean, if we're seeing an outcome of 2 times better by doing early detection, and also by managing the disease, in the sense that you're monitoring the signal post-operatively and over the course of the life of the patient. It's just exciting to see what, over the lifetime of the patient, how much it's going to improve the outcome for that patient. My guess is a lot. Because you said it before, that the tumor was a grade 1. It was small. It didn't seem to be metastatic at all. And if you're able to catch cancer that early, there could be no reoccurrence at all whatsoever, and so that solves the problem. That's just I just can't Do we have any idea, Dr. Flory, how many patients are using it? Because I want every dog all over this country, all over the world to be using it, to be on it, because it prevents all the problems and a lot of the expenses and the heartbreak and everything downstream. So do we know how many patients are using OncoK9 DX right now?
I think that's exactly it, Luke. It's, it's platforms like yours that get the word out, right? And spread this information and education that this is now available, especially for those breed enthusiasts, those people that just love these high risk breeds. People are never going to stop loving golden retrievers and Bernese Mountain Dogs and flat coated retrievers and all of these breeds that unfortunately they just have a really high lifetime risk of developing cancer. And so any tool that can help them or their veterinarian know earlier is just a chance for more time, more options to choose from, easier cancers to treat, more likely to be controlled in the long term, and possibly even a higher likelihood for cure. So, it's really great and exciting to have the ability to kind of spread the word and let people know that this is now available. I mean, thousands of dogs at this point have been tested with this. And the important thing to think too is, we'll talk about this next, but it's not just a case like Kelly's in a dog that has had sickness or clinical signs, but it's also in asymptomatic dogs where you're not yet thinking about cancer, but that's actually the best time to start looking for it and to start thinking about it, especially when you have these high risk breeds, because we can find cancer even before the onset of clinical signs by using this as a screening test. And so the time to kind of think about that is actually before patients are sick, before our dogs are sick.
Do you have, I have so many questions, so I'm going to jump around. My apologies, but I'd have to ask a question when I think about it.
Okay, hey, I wanted to interject something here. So to go back, my dog Sadler, we used the PetDX on him and it came back that he had cancer, but originally he had a mass on his spleen that was removed and it came back benign. Same thing with my dog, Lily, and they both wound up like within a year having cancer. Unfortunately, Sadler didn't survive, but Lily is still kicking 6 years later. But a friend of mine's dog, Big Papa, a big English bulldog, had a mass on his spleen. We go to the same veterinarian. And so it came back as benign. And then everybody at the vet clinic was just so worried about it because of Sadler that now I think anytime that a dog comes back with benign tumor on his spleen, she's doing the PetDX. She's running that.
And you bring up a really good point, Ginger, because hemangiosarcoma is a tumor that develops really from blood vessels. And it means that these tumors are very bloody. They develop big pockets of blood and bleeding within the tumor. And when you send a sample in for a biopsy, you have to think about, if you think about that tumor as like a basketball, the different kind of piece of a pie that you take out of a basketball could vary vastly from the left side to the right side, to the top to the bottom. And some of it's just composed of blood and very benign looking cells. And some of it's composed of very scary malignant looking cells. And the ability for the pathologist to make the call on what that is when they look at this tissue sample is very much dependent on the piece of tissue that they get from that basketball. So we have seen certainly cases where they've gotten a diagnosis of a benign tumor of the spleen, but we see signal, and then that patient ends up, with metastatic hemangiosarcoma just within a few months. So it's another situation where I feel like it's so exciting to be part of this new era where we have just multiple tools. We have our standard tools like biopsy, but we have now adjuvant tools that we can use with biopsy to further help us interpret what the biopsy says, like liquid biopsy. And that's the name for this technology, is being able to look in the blood and see if there are additional markers that we can't see in the tissue that are harder to find in the tissue. And it can just add to our ability to overall put the puzzle together, because every patient's case is very much a puzzle, and it's another piece of the puzzle, another tool in our toolbox.
It just as you were talking, I literally inherited an older dog with heart issues, and we found a growth, but the vet really couldn't get a whole lot of cells out of it. But she said some of them look kind of funny, and so we were thinking, well, do we need to, actually biopsy it? But then we would have to anesthetize her, and because of her heart issues, we don't want to do that. So I'm like, well, we'll just do a PET. While we're talking, I'm like, well, we'll just do the liquid biopsy. I'm scheduling that when we get off the phone.
Yeah, it can help in some of those cases. The one thing that I would just say as a reminder is that it can't detect all cancers. So you could have a small skin tumor and that that's cancer and it's present on the patient, but the test is negative, because you do have to think about, well, how much DNA is being released from that tumor in order for it to be able to be detectable in the blood. So that's kind of one thing to keep in mind, that it can't help with all tumors. I think that where it really excels is in especially cancers that are maybe more difficult to access. Like you can't access them with routine tools like an aspirate or a biopsy, like something on the skin and things like that. But it is a really great new tool to use in those exactly situations like you said. Well, we can't sedate, we want more information, but what can we do as a next step?
Yeah, and you have the big ones. You have the big cancers. 30 cancers, that's a lot. I mean, 30 different types of cancers, that's a lot. That's a big list. We know there's a lot more, but you have the big ones. You mentioned Bernese Mountain Dogs, Berners. We love them. We have so many Berner supporters and friends in our Puppy Up family. Just want to confirm this. Does it test for histiocytic sarcoma?
It does, yeah, and that's a cancer that's on the list. And I like to think in examples. So the case example that runs to the top of my mind is this dog named Ayla, and Ayla's a Bernese Mountain Dog, and she was just kind of getting to that age where we start to think about cancer. I think she was about 6, and she had OncoK9 DX performed as a screening test, meaning this was at her wellness visit. Her wellness visit was normal, no suspicion of cancer, but her test came back positive. And long story short, they did a workup, found some nodules in her lungs, and ultimately ended up diagnosing histiocytic sarcoma. But this was all made before she ever had any clinical signs. And it meant that for her family, they were able to kind of figure out what they wanted to do, go and pursue a consultation with the oncologist. And so that, that's a story that for that family, it's so beneficial because they don't have to see their dog get sick and make decisions that are when she's still wagging her tail and running around. I think one of the hardest things about sometimes being a veterinary oncologist is when we see those cases that are diagnosed when patients are really sick. And because of how sick they are, it's really hard to know how likely is it that the family is going to what are their goals here, like in terms of going for treatment, or what's the likelihood that this patient is going to respond to therapy quick enough for everyone to sort of see that quality of life return, which is generally very quick, but it's harder for a family to make that decision when they're watching their dog that's sick, right? So even just finding it early, I think that we have a better chance at being able to treat those patients in the first place.
In every respect, because it's a multi-front battle. I mean, your body is in crisis mode, and you have to focus on things like diet, and you have to do everything. And so, yeah, the sooner you know, the better. But it all depends on, like you were said a second ago, and this is my next question, is signal sensitivity, though, right? So do you have any idea how sensitive the signal, how sensitive your tool is to the signals? How early of a cancer can you detect, I guess is my question.
Yeah, so sensitivity, that word, what that word means is how good is the test at detecting cancer, right? And so because this is a multi-cancer test, we kind of look at groups of cancers. So in those big three that I mentioned earlier, which I think are the most concerning, lymphoma, hemangiosarcoma, osteosarcoma, the sensitivity is 85% in that group. In the 6 most common cancers that we see in practice, the detection rate is 62%. So it can detect most cancers. We also can then split it out by, early detection. And early detection can actually mean a few things. It can mean early stage detection, but it also can mean early clinical detection. So early clinical detection is like detecting before a patient is really sick, before they're showing really advanced clinical signs or symptoms. And so the test can detect about a third of early stage disease and about half of early clinical disease, which means that this is a test that can detect cancer even before dogs are sick. So again, this goes back to that idea of cancer screening, which is looking before dogs are sick to have a better chance of catching it earlier.
That's great. I'm not sure sensitivity was the exact word I was looking for, but I guess I was trying to figure out if we know exactly how advanced the cancer has to be, or developed, and it has to be. But that answered my question. Next question I have, which is interesting, is we talked last time about you making the recommendation whenever you should have your dog screen, right? Whenever you should first take the test. And I think you said at 6 or 7 years old is when you're recommending. Is that accurate?
Yeah, so we did, one thing that was kind of missing from the veterinary literature or kind of the amount of, published studies that we have in dogs is we actually didn't even really have a great source for when we should start looking for cancer. And so we did a study in over 3,400 dogs, and we looked at the age at cancer diagnosis. And from there, and using some biological modeling, we were able to come up with specific recommendations for all dogs, and then dogs of specific breeds and dogs of specific weights. So for all dogs, it's recommended to start at the age of 7, but some breeds that are diagnosed earlier in life should start as early as age 4. That includes a lot of the giant breeds. It includes bulldogs. It includes boxers. Those are dog breeds that tend to be diagnosed earlier in life. So they should actually start screening earlier. And then there's also a way to look at, well, what if my dog is a mixed breed dog or a designer breed dog? Then we can look at what age are dogs of a similar weight diagnosed, and we use that to make that calculation. So we took all of that data and we actually turned it into an online tool. It's called the Cancer Safe tool. It stands for Screening Age for Early Detection. And you can find that at cancersafe.petdx.com. And that allows you to input your pet age, breed, and weight, and it will give you a specific recommendation for this dog. When should this dog start cancer screening?
Yeah, it's so wonderful that you have that tool. That's exactly what I was asking and was getting to. Because what we're talking about elliptically is that if I have a giant breed dog, or I know a breed that's predisposed to certain types of cancers, such as a Berner or a Golden, then I'm going to start early screening, a lot younger. And because Ginger and I have both seen Bernese Mountain Dogs with bone cancer as young as 4. Well, we've seen dogs as young as 6 months with lymphoma, but those are outliers, right? Those are statistical anomalies. So, but we do know that we are seeing certain types of cancers diagnosed earlier in specific types of breeds. So, do you have that, aside from the SAFE tool? Do you have that data published anywhere? In any journal? I'm a data guy. I would love just to read the data on the different types of breeds, and when is that available?
Yeah, so you can find that on our website too. That is in a journal called PLOS One, and it is it's a publication looking at age at cancer diagnosis by age, breed, weight, sex, a lot of different variables, so that you can kind of cross-reference and look up, what age were different breeds or different, weights of dogs and things like that diagnosed.
In broad strokes, I get this question a lot, and I know we don't have we don't have a lot of data, so we just have the available data. But I always get asked, are pure breed dogs more predisposed to cancer than mixed dogs? And if so, is it at an earlier age? Do you have a sense of that from your research, from your study?
So yeah, that, I mean, that one's it's harder to say for sure because one thing that we don't have in veterinary medicine like they have in people is the overall prevalence or incidence of cancer or cancer by breed or cancer by type, right? Cancer in people is a reportable disease, therefore we know, different ages, different cancer types, different locations in the body. We know all of that. We have that data, but it's not like that in dogs. I think there are a lot of cancer registries that are working on that, and I hope that we will have some more reliable data in the coming years. So that's exciting to think about. But what we did find in our study, in the 3,400 dog study, was that purebreds actually were diagnosed significantly younger than mixed breed dogs. It was about a year difference. So, but a year in the lifespan of a dog is more than a year to us, right? So, that does suggest certainly a higher risk, at least for earlier diagnosis.
That's tremendous data. And I had a sense of that, and because I talked to so many veterinary oncologists, and I do a lot of research and read a lot of things, and I had a good sense of that. And I'm so fascinated that your study confirmed that with a very small population. But you're right. I have everybody I talked to. I was talking to Sean Khanna one time. I was like, why do we need the denominator? We don't have the denominator to divide to know exactly what the incidence is. And without the denominator, we don't know anything. But that's a huge, that's a Herculean task to be able to acquire that vast amount of data. But that's a lovely study. Ginger, we definitely want to link to that study. I would put that study alone because I know every single pet parent that I know would love to read that study, would love that data. I mean, it's certainly not going to convince, like you said earlier, Dr. Flory, people that want a golden are going to get a golden. People that want a Bernese burner, they're going to get a burner. That's always going to be the case. But at least to have the data to know, okay, well, if you can get that, but the responsible age to start screening now is 4 years or 5 years instead of 7 or 8 years old. All right. Every time I talk to you, I just have lots of questions I write down and additional things I want to ask. But I want to get to your new feature, which we kind of elliptically spoke about it earlier. So you've expanded your toolkit, and this is fascinating. This is what companies, wonderful, innovative companies like PetDX, that's what they do. They're supposed to do. So you expanded your toolkit, and you now have, in addition to OncoK9 DX, you also have OncoK9 Screen. So tell us all about that and how that works.
So OncoK9 Screen is a test that, as the name implies, it's meant to be used for screening. So screening, the definition of cancer screening is really a test that helps to detect cancer in an asymptomatic patient. So again, just to draw that parallel to people, we go for mammograms, colonoscopies, PSA tests, and we do that when we're asymptomatic. And the test that they do on us is not intended to diagnose what's going on. It's meant to look for evidence of disease, right? And then you do additional tests to confirm the diagnosis. So the same idea here. It's a screening test. It's meant to be done in asymptomatic patients, and it's also meant to be done serially, meaning to have the best chance of catching cancer early in a patient that ultimately has cancer but develops it over time. You need to do that test serially, just like we go for, we don't just do one mammogram or one colonoscopy in our life. We do that at the recommended interval. So same idea here. And so this test it's intended to be a lower cost cancer screening test. It's great to add into a wellness visit, for example. So just add into your wellness physical exam and blood work that's typically performed. And that's usually either once or twice a year as recommended by your veterinarian, just based on your individual pet. They may recommend once a year, they may recommend twice a year, just depending on age and anything else going on. So it's intended to be used with those wellness visits. This is a test that it starts by looking at the quantity or amount of that biomarker that we look for called cell-free DNA, but then it adds in the power of genomics, the power of sequencing for test samples where it's necessary. So this allows a test to be a lower cost because it's not always necessary in all of those patients. And it means that this can be, you know, more available to a wider number, hopefully, of dogs by adding this into a wellness visit. Because there are some things that could cause elevation of that biomarker called cell-free DNA, we need to use this in specific patients. So one, it's supposed to be used at a wellness visit when a patient is, you know, otherwise healthy, seeing your vet kind of for routine kind of stuff. And it's not recommended to be used with contraindicated conditions. So there are things that could cause release of that biomarker, like surgery or trauma, like, you know, having an injury or something like that, severe infections, organ failure. Pregnancy actually can cause an increase in cell-free DNA. Other diseases like autoimmune disease or inflammation or infection that's more severe. So there are specific parameters for the patients we would want to use this in and not. If they have those conditions and it's a situation where you can just wait until those conditions resolve, then you can just wait, or you can always still use the sequencing-based test. You can always still use the DX test in those patients. Those conditions generally are not, don't prohibit those patients from having the DX test. And so this is, you know, again, it's a way to add cancer screening into a wellness visit at a bit of a lower cost.
Well, that's essential. I mean, I think that's what completes it, because if we're only talking about thousands and thousands of dogs, I think we have 40 million dogs in this country alone. And in the way I view the world is every dog, every pet parent should be doing this annually. Because I just don't know how with specific breeds, pet parents just aren't worried all the time that as their dog gets older, that they're a ticking time bomb essentially. But like human screening, though, I know we had Dr. Phil Bergman on not too long ago, and he was diagnosed with bladder cancer, and he has to go in. I think it's every 6 months or a year and get tested. Is the screening, is it meant to be more specific for a specific type of cancer, or rather than just all the cancers? Is that what we're talking about?
So it's also a multi-cancer test,
Right.
but it really, when we developed the test, we wanted to make sure that we developed a test that had good sensitivity for what we call clinically relevant cancers. That basically means cancers that may be harder for your vet to find on a wellness visit because they're either internal or they're just hard to access with just a physical exam, or you wouldn't evaluate them very easily with blood work, for example, and where finding them earlier could help your vet to intervene earlier, and that have been shown to have improved outcomes when we find them earlier. So we kind of narrowed that down to a list of about 7, again, what we call clinically relevant cancer types. And the detection rate of this test in those 7 cancer types is 71%. And the detection rate in those 3, again, we talked about those 3 aggressive common ones, lymphoma, hemangiosarcoma, osteosarcoma, was 73%. But again, very, very low false positive rates in this test, just like in the DX test.
Yeah, that's wonderful. So how often do you, under what circumstances are you recommending screening dogs? So we need to kind of put this into an actionable item for pet parents. What's your recommendation?
So if you're going in for a wellness visit, you know, you're going in for your annual vaccine visit or, you know, things like that, then this would be a good test to use. You don't want to use it if it's like, well, my dog has been sick and vomiting and I don't know what's going on, or my dog collapsed, or like cancer is a possibility. If cancer's on the differential list for the veterinarian, we generally would recommend use the DX test. That's the better test to use. This test would be good, though, for any patient that has chronic but stable conditions. So many dogs, as they get older, they have conditions, right? They have comorbidities, we call them. Like they've got skin disease, like, skin allergies, and they've got itchy ears, and they've got dental disease, and they've got all of the things that an aging dog population has. And those conditions, as long as they're stable, they haven't required new treatment in the last 7 days, generally those dogs are totally fine to test. But if it's a condition that you're going in specifically for this thing and it's causing pain or inflammation, or you need to get a new medication to control it, you probably just want to hold off until that's more stable. or you could always use the DX test.
When do you recommend, or did you say 7 or 6 is the age that you're recommending?
So the recommended age to start screening for all dogs is 7.
Okay.
But for dog breeds that tend to be diagnosed earlier in life, as early as age 4.
As 4, that's good. What about I know it's so hard to talk about pricing, but that is a relevant thing to talk about because Ginger and I think we got our first 2 tests. I think differently, they were comped or something like that. But we've had several more that I know that we paid for. One was Indiana Jones. He had a tumor in his pharynx, and that he was being anesthetized for he has peripheral neuropathy. So they intubated him, they saw a tumor, and so of course I freaked out, had a couple of heart attacks, and we biopsied it, and it came back negative cancer, and which was atypical. A tumor in that location, a mass in that location wasn't. He hadn't been intubated before. It shouldn't have been some type of trauma. So we had it reviewed. We had a pathology review. But even still, I wasn't satisfied. So we did it again, and we got it. So we got another test. We had a PetDX test on Indiana, and it came back negative. Thankfully. So I know it's expensive for the average pet parent. How much more reasonable do you think the screening is going to be? Do we have kind of a target retail price to give the pet parent an idea, or is it going to be like 50% less, or?
I would say the way that most veterinarians are using the test is when they add it to a senior wellness panel and they kind of roll it into that, whatever that pricing structure is. Like sometimes you pay for like a wellness package, right? And you pay over the year and it kind of rolls into there. If they're selling it just as a standalone test, not as part of a package, I've seen that most clinics seem to be selling it around 200, like 199, I would say is pretty typical for most clinics. So so that's just specifically for the screen test.
So it doesn't substantially increase the cost of a wellness exam and all the other things, especially when you have a geriatric dog, it gets expensive, as we know. What about insurance? I think we talked about this a while ago, but I think it was still relatively new. Is our insurance, because to me the mathematics make total sense, right? This is a screening technology that prevents a disease from manifesting and becoming a much bigger, much more expensive problem. So it just seems logical to me that insurance insurers would be all over this, and maybe to a certain extent packaging them in with the annual wellness visit, or at least covering it. So where's insurance at covering the cost of PetDX and OncoK9 DX and OncoK9 Screen?
Yeah, I mean, I'm right there with you on the reasoning, but I think what I've seen so far is that most insurance companies seem to be covering this OncoK9 DX test as a test when a patient either is sick or already has cancer. So as a monitoring test or as what we call an aid in diagnosis in a sick pet, then they seem to be covering it. As a screening test, it seems to be some are and some aren't, and it seems to just depend on the situation. So I would say try to submit it and see what happens. And I don't know of a way to kind of predict, but I think that the insurance companies are also all looking at this. You know, this was new technology as of only 3 years ago. So they certainly have to adopt to new ways of practicing as well as veterinarians do. So I would say that we keep trying and seeing, but I have definitely seen some companies cover it at certain insurance companies even as a screening test.
The adoption curve in the medical industry is slow, as it should be, and when you're introducing something that has medical and health implications into a very large population, it probably shouldn't go fast. But the covering it, though, that should happen a little bit faster. I'm a true believer in it, and I've lost through all three of my dogs I've lost to cancer. So to me, the economics, they don't matter to me. I just pay for it. We have to know. We have to know what we're dealing with. They're part of diagnostic. But to wait until the disease has manifested to a certain extent, you're not losing that preventative advantage. And I just don't understand why in this country, even with human medicine, the focus is on, treating a disease once the disease has actually occurred. And there's much less of an option, at least from financial perspective, regarding insurance. There's just much less of an incentive on preventative or anticipatory care. And that's unfortunate. But regardless, I don't want to get mired down in that because, as a pet parent, in the case of Kelly, I already know the average cost of dealing with a hemangio patient, especially after you have rupturing and you have internal bleeding. It's extremely expensive. We're talking tens of thousands of dollars, many nights in the ER. It's a nightmare scenario. So I already know the cost of the OncoK9 DX is substantially is exponentially less than that. So it's an easy decision. So I don't want pet parents to get mired down or concerned about that. But I just think, is there any way, I don't know enough about the insurance industry to get it as a standard, to get it as a protocol, to make it a protocol? Is that possible?
I think that the really exciting thing that we're getting to do with this brand new technology is we're almost doing this alongside what's happening on the human side. I don't know if you're aware that there are these tests for people, specifically, for example, a test made by the company Grail called Gallery. This is a multi-cancer early detection test for people. It can detect 50 different types of cancer with a blood draw. And this is a test that's available now. It's available and recommended to be used in people over the age of 50 and or with a family history of cancer. You do have to have it ordered by a physician, so you need to ask your physician, and then you get a special kit that has the blood tubes, and then you can take that to LabCorp or Quest or wherever you have your blood drawn. And there are studies that are being published and are ongoing as we speak, looking at exactly this of the ability for early detection. And as those studies are published, then that really starts to change, I think, the conversation. And once that happens in people, then I think the same will happen in dogs. But it's really amazing and exciting to get to do this at the same time that this same conversation is happening in people. It's really cool.
It is. Well, as you and I both know, and I think maybe the entire scientific community is moving towards the adopting as the concept of one cancer. This is a shared cross-species disease. It affects all of us. It's related not only to our genetics, but also the environment as well. So, the human and canine medicine or veterinary medicine should have always done a better job of walking hand in hand. But we've lagged. Veterinary medicine, as we know, has lagged by several decades. But you're right. It is exciting to see veterinary medicine pretty much for the first time, kind of leading the way, kind of clearing the path for human medicine. But I think that's wonderful. All right. We're running long, and I want to make sure that we get everything I had on my list of things to go over. Webinars. That's something that Ginger pointed out, because I want, I love reading, and I love reading getting my hands on as much data as I can, so I understand things more. But oftentimes it's where do you acquire the knowledge? And so Ginger was excited that you offer webinars now. So tell us about that.
Yeah, we have webinars available there, so you can on petdx.com. I mean, they really are geared towards veterinarians, so some of it may be kind of language that is really geared towards a kind of a clinical audience, but there are webinars in general. If you're interested in nerding out about the science, then you can kind of watch those. There are some that are recorded that are available on petdx.com. We have another one that's coming up that will be available on February 28th, again on petdx.com, and I believe OncoK9.com as well. And that one is about the new screen test. It really covers both tests, but it covers the new screen test as well. So yeah, the webinars are a good way if you, like I said, like to nerd out over all the data.
I do, and I like the technical aspects because it just sort of inspires me to learn more about particular topics. But it is CE, so it is for veterinarians, but pet parents can access them as well. But we do have veterinarians that watch and listen to Fuzzy Butts and Friends. So that's also why I wanted to bring it up, because it is accredited. And I encourage all the vets that listen to us is to go out there and learn as much as you can, because they sort of they are your marketing arm, or I guess they're the point of sale, if you have to think about it that way, because not all pet parents are going to watch Fuzzy Butts and Friends. It's just there's pet parents they come in all sorts and all flavors, and it's hard. You can never get them in one place to get all the information to them at the same time. So we rely on veterinarians to provide pet parents with that information. So it is important for GPs and country vets to know about this wonderful tool of yours. So we're definitely going to link to the new OncoK9.com website and PetDX as well, and also some of the research, because even if you're not a veterinarian, at least in terms of the dog breeds, because that confirms, at least on a very small scale, some of the things I've been talking to with other oncologists and some of the research I've been doing. All right, is there anything else? We've got what about, are there any other additional studies or new clinical data or clinical validation that I missed that you wanted to discuss?
I mean, I think I was looking at the timeline of when I last got to chat with you guys, and it was quite a while ago. It was late 2022, and we've actually published 6 publications since then. So there's probably too much for me to cover here, but I will say that one of the exciting things that we have ongoing is a lifetime study. It's called the Cancer Lifetime Assessment Screening Study in Canines. The acronym there is CLASSIC. And this is a study that's being conducted at multiple sites across the US and Canada. Dogs are enrolled and then screened with OncoK9 every 6 or 12 months. And it's really looking at the ability for OncoK9 to detect cancer early, but also what is that serial detection when we do it over a lifetime, and how well that can detect and that sort of thing. So it's a really, really exciting study. We're going to present, this is because it's a multi-year study. We'll do multiple kind of interim analyses, and we're going to be sharing the results of our first interim analysis at a couple of conferences later this year. So we're looking at kind of dogs that have been enrolled for at least 1 year and have had at least 2 tests. So it's a really, really exciting analysis that we're working on.
Cheers to that. That's fantastic. A lifetime study. That's wonderful. It's just your company's just doing everything right. You're developing new tools. You're expanding your toolkit and your toolbox, and also you're publishing public studies and performing more research and data, and I think that's essential. So so that pet parents know, our audience knows, what are the criteria if I want to get my puppy dog, one of my Fuzzy Butts, enrolled in your lifetime study? What are the criteria?
Yeah, you can check out our clinical studies page on petdx.com. Right now, we have a pause on new enrollments. So we're kind of doing this interim analysis of the dogs that have been enrolled to date. But check that out, and you can kind of look and see if there are sites available in your area when that reopens.
And it gets expensive. And the lifetime golden retriever study, last time I checked, we actually had, unfortunately, I can't recall her name, Ginger. We've had so many guests, I meet so many people, but we had the director of the golden retriever lifetime study on, and I think she said it was 25 million. It was a big number. Those get very expensive. Data and research cost a lot of money. So I'm glad that you're making that investment back into it. So it's not surprising. You can't just open up a lifetime study, because that becomes nightmarish. Do you know how many dogs you currently have enrolled in the lifetime study?
Yeah, we have over 700 dogs enrolled to date.
That's great.
Yeah.
Excellent. I'm gonna look that up, and as soon as, is there an age cutoff though, or I guess my first question is, does your dog have to be diagnosed with cancer, or just are you doing the screening aspect of it?
No, yeah. So just for screening, so just for
Great.
asymptomatic dogs where cancer has never been diagnosed and is not suspected, as enrolling when they're in that higher risk age bracket. So either at the age of 7 or 4 for high risk breeds.
So 4 or 7 and asymptomatic is kind of the general guideline. God, I didn't realize it was 2022 since we last had you on, and you guys have done a lot of things. Well, we can't let it go this long until next time because you're just expanding. You're doing so many interesting things, and it's always good to have our new listeners current with your work. And as a reminder too, because I mean, every pet parent needs to know about OncoK9 and PetDX and have that tool in their toolbox, because I know Ginger and I, we've doing, how many tests have we done, Ginger? 5 or 6 so far, I think, is what we've done with your kids and my kids.
Let's say you did 5, 6, 6.
6. Yeah, so we're
And he's the only one that's been tested twice, I think.
Yeah. So we're in our own way, we're lifetime supporters and part of their lifetime users. As long as I have Fuzzybutts, I'll be using it, using your technology. All right, Ginger, is there anything else that I missed or anything that you know that I left out that maybe you wanted to mention?
No,
Anything or screw anything up is my question.
no, you didn't screw anything up this time.
Yeah.
So, we usually have a canine cancer tip, and the whole podcast has been about early detection. So that's a hill I'm going to die on, is early detection, lumps and bumps, get the screening or the PetDX test, where I guess it's available to everybody, with the veterinarian. So ask your veterinarian. If they look at you funny, tell them to go to petdx.com.
Well, yeah, you have a lot of veterinarians out there that are talking about cancer as a manageable disease. And okay, well, if we're going to talk about that, a prerequisite for cancer being a manageable disease is early detection. You can't exist without early detection and screening, or else it becomes unmanageable very, very quickly. So PetDX and OncoK9 is an essential part of that agreement. So what you're doing is making that a possibility. I shudder at that because I'm of like, let's figure out what's causing it. Let's just get rid of it once and for all, which is impossible because we know DNA mutations are always going to occur and it's always going to exist. But I want to get cancer down to a more normal level, at least not a super normal level, which is where we're at. And that's just never going to occur without early detection and screening. So, Dr. Flory, thank you so much for coming back on our show again and sharing all the wonderful studies and research that you've been doing, and the OncoK9 screening, the new tool in your toolbox. Is there anything that I left out, Dr. Flory, or anything else you'd like to share with our audience?
I think I would just close with exactly what you said, that, as our pets age, they're at risk for a wide variety of conditions, be that arthritis or endocrine disease like hypothyroidism or cancer. And the earlier your vet is aware of any of those, the earlier they can intervene, and just the better it's going to be in the long run for your pet and for you and for your vet. It's going to be easier to manage. And it also puts you in the driver's seat of being able to make those decisions. It gives you the power of making decisions about care. And if it's found too late, it could be an emergency, or there may be no options, or there may just be few options. So finding it earlier just really turns cancer into something manageable, into something that is more likely to be treatable. And it's better to start thinking about it before your dog is sick, like to start thinking about it, adding that into a wellness visit. But if your dog is starting to show signs of what we call slowing down, right, which could be such a wide variety of things, there's also tests here, OncoK9 DX, that can help your veterinarian really understand what's going on, shorten the path to diagnosis, and just help figure it out sooner. And again, early detection is key.
Yes, and everyone, I recommend that you go to what was the SAFE website again? What was the URL for that?
So it's cancersafe.petdx.com.
Cancersafe.petdx. Cancersafe. Yep. And make sure, everyone, you go to that and learn for your breed, the breed of your dog, when is the best time to start taking in with their first wellness examination, and when's the first time to get their screening. Now, if our audience members go online and go to the website and check it out, and they say, oh, well, okay, it's time to take my Bernese Mountain Dog in and get screened. Is that available at their veterinarians, or do they have to, if it's not, do they have to tell their veterinarian? How does that work, Dr. Flory?
That's a great question. Yeah, so their vet does need a special kit because we have to use special blood collection tubes that stabilize the DNA. So their vet needs to have a kit ahead of time. They can get that either through contacting us directly, petdx.com, or they can actually get those kits through their diagnostic partners, which are Antech and IDEX. Those are the most common labs that most veterinary hospitals use, and they have the test as well. So they could actually get the kit through those options as well. So most veterinarians, all veterinarians, I would say, in the US and Canada have access through those 3 routes.
Yeah, I just had the thought of like a pet parent going in after listening to this and say, well, my Bernese Mountain Dog's 6 years old, it's time to get screening. And the vet's response is, I have no idea what you're talking about. And then, because that could be discouraging and self-defeating. So if you're a pet parent, please, with your veterinarian, please share OncoK9's website and PetDX's website so that they can get educated about this wonderful tool for our canine companions as well. All right, what a wonderful episode, and we will make sure next time we'll have you on to update us again on what's going on and share your wonderful tools and technologies with our audience. I will make sure it's not so long in the future next time.
Hey, I would love to come back anytime.
I think we should do a screening. We'll have it once a year. We'll have our wellness once a year. It's PetDX. We got to remind the public of your technology. We'll do that once a year.
Sounds
All right.
good.
All right, everybody. Well, thank you so much for joining us for this episode. I'd like to thank Dr. Andi Flory. She is the Chief Medical Officer at PetDX. Find out more, you can go to OncoK9.com or PetDX.com. And the other one, the safe one, I didn't write it down. What was that website?
Cancersafe.petdx.com.
Cancersafe.petdx.com to check out if it's time to get your fuzzy butt into your vet and get a cancer screening. Thank you, everybody. Thank you, Dr. Flory, for joining us again.
Thank you.
Thank you, Ginger. Until next week, everybody, puppy up. Talk soon.